Good morning and thank you for attending. Today I'm joined with Dr. Zimbalati, public health physician, to give an update on our local COVID-19 situation, and Andrea McClellan, director of COVID-19 immunization strategy, and she'll provide an update on the vaccine rollout. But before we proceed, I'd like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850. This land is the traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I would also like to acknowledge the Métis historical presence in the region. September 30th is the National Day for Truth and Reconciliation. The Health Unit is recognizing this day as a designated holiday and will be closed to commemorate this important day. Therefore, we will not be hosting a press conference next week. On this occasion, we ask that employees and community members take the time to reflect on the legacy of residential schools, the intergenerational trauma it has caused to Indigenous peoples and communities, and how we can all contribute to the process of reconciliation. Yesterday, the Provincial Vaccine Certificate Program came into effect. It is understandable that there is much confusion about the requirements for proof of vaccination. And please know that your vaccine receipt that was emailed to you after receiving your second vaccine is the proof you need, along with a form of ID. If you can no longer find this email, you can download and print your receipt at ontario.ca/proof of vaccination, or find the link on our website. If you're having problems navigating the Ontario website, give us a call and we can help you get an electronic copy. Should you not have access to the internet, please call the Health Unit and we can print your receipt for you. But we ask that you do not walk in without calling ahead of time to have your receipt printed, as the front reception really cannot accommodate the request due to work capacity. We'll likely have it for you by the following day. We have heard some confusion about the watermarks on the form. Watermarks are not required to be on the vaccine receipt. Businesses have to verify that the receipt is either an Ontario receipt issued at the time of vaccination or downloaded after, a receipt signed by an Indigenous health provider, or a receipt from another jurisdiction that shows the holder is fully vaccinated against COVID-19. So with that, I'll pass it over to Dr. Zimbalati to give a local COVID-19 update.
Thank you, Dr. Chirico. In the last 7 days, we had 8 new cases, bringing our total case count to 738, with 515 in the Nipissing district and 223 in the district of Parry Sound. The health unit currently has 8 active cases. There's currently 1 active case that has screened negative for mutations but is presumed to be the Delta variant, as 97.8% of the cases in Ontario are the Delta variant, and the Delta variant has neither of the mutations that are targeted for screening. Some new cases are still awaiting further testing. Currently, there is 1 individual in hospital due to COVID-19. Since June 1st, 67% of individuals eligible for the vaccine who tested positive for COVID-19 were unvaccinated, while 25% were partially vaccinated. 8% of cases have been identified as breakthrough cases, meaning individuals who have tested positive for COVID-19 were considered fully vaccinated. Furthermore, 29 cases were born in 2010 or later and are not yet able to be vaccinated. Since the beginning of the school year, there have been 5 cases in school and childcare settings. However, no outbreaks have been declared locally, meaning we have not seen transmission within the school or childcare setting. We have had reports that individuals are using rapid antigen tests to determine if someone who is symptomatic has COVID-19. A negative rapid antigen test when symptomatic is not an acceptable way to test for COVID-19 because the test is not as sensitive as a PCR test, which is available through assessment centers. You may be putting others at risk by relying on a rapid antigen test when you are symptomatic. If you or someone in your household has any COVID-19 symptoms, please contact a local assessment center to have a PCR test completed. Now back to you, Dr. Chirico.
Thank you, Dr. Zimbalati, and we'll turn it over to Andrea McClellan and give us a little update on our vaccine rollout.
Thanks, Dr. Chirico, and good morning, everyone. As of 3 p.m. yesterday, we are now at 84% of residents 12 years of age and older who have received at least one dose of a COVID-19 vaccine, and 77% of residents 12 years of age and older who are fully vaccinated. Additionally, 78% of youth 12 to 17 years of age have received at least one dose of COVID-19 vaccine, and 64% have received both doses. As of 3 p.m. yesterday, a total of 183,890 vaccinations have been administered in our district. The current target remains to achieve 90% vaccination rate for both first and second doses. In order to achieve this goal, we need to administer an additional 7,216 first and second doses to individuals who have not received any of the vaccine yet, as well as an additional 7,672 second doses to those who have already received a first dose. We continue to work with our municipalities and community partners to offer clinics which help to reduce barriers for those looking to receive their first or second dose, including the use of our mobile vaccine clinic. We have not heard if third doses will be provided to third doses or third boosters will be required for the general public. Just a reminder that anyone requiring assistance with obtaining their vaccine receipt can contact our call center at 1-844-478-1400, and our staff will be happy to assist. We continue to be proactive in our planning for when the COVID vaccine is available for individuals aged 5 to 11 and for planning for the flu season. Once we're able to start offering flu shots clinics, we will let the public know through social media, our website, and our local media. Now back to you, Dr. Chirico.
Thank you very much, Andrea. That concludes our remarks. So we'll start taking questions. You put them in on the left of the screen, and please associate your name with them if possible, and we'll try to answer as many questions. And if we don't have the answers, we'll try and get back to you as soon as we can with them.
Thank you. Our first question is for Dr. Chirico. It comes from Greg Esterbrooks at Cogeco News. To eat in a restaurant currently, you need to show proof of vaccine, but staff are not required to be vaccinated. Could you explain that paradoxical situation?
Well, thank you for that question, Greg. It is a good point, and it certainly does seem to be out of keeping with certainly wanting everybody to be vaccinated to go into a restaurant. I wasn't part of the discussions. It was an Ontario decision, but what we do and what we can say is that we work with the businesses to really encourage them to have a vaccine policy in place that will help protect both certainly their staff and people that come in or their patrons.
Thank you. Our next question is also for you, Dr. Chirico. It comes from Chris Dawson from Bay Today. Are you concerned with fraudulent passports or certificates, and what can happen to someone who uses a fake vaccine passport or certificate?
Yeah, thanks for raising that, Chris. There's always situations where that's going to occur, where people are going to produce fraudulent vaccine certificates. What they need to know too is that you can be prosecuted for doing that. I think that the other thing I wanted to mention too is that the whole process is being put in place to really help protect everybody, and so we really hope that this is a very, very small portion of the population that may be doing something like this, and I think it is. We've had tremendous uptake in our vaccines. We've found that the vaccines have really helped to reduce serious illness and hospitalizations, and that right now, the fourth wave, because we've had so many people vaccinated and because of the continued public health measures, we're seeing that there is a bit of a plateau. Hopefully it stays that way and goes down and doesn't increase. And I think that's credit to so many people being vaccinated and so many people following the rules. So we hope that certainly continues.
Thank you. Our next question is for Andrea. It comes from Chris Dawson from Bay Today. The vaccine bus has had long lineups. How successful has this form of vaccine rollout been?
Thanks for that question, Chris. We believe that the mobile bus has been exceptionally successful and well received by the public. Last night, despite the rain, we immunized 173 people at the bus between 3 p.m. and 6 p.m. And people didn't seem to be bothered by the weather. We've got processes in place that support them being immunized and being able to wait in their vehicle in the event that the weather is poor. Other bus clinics that we've held, we've done over 300 at a couple of clinics, 150 plus at other clinics. In some of our smaller communities, we've done 50, 60 people at clinics. So I believe that that bus has been extremely successful in getting our numbers up. We're seeing a lot of people coming for their first doses. We've been able to accommodate a lot of people who are eligible for their third doses. So I think it's been really helpful. And some of the feedback from the public has been that, you know, I hadn't even been thinking about getting it, but I saw you here, it was convenient, and so I came.
That's great. Our next question is from Rick Coffin at mynorthbaynow.com. And it is for Andrea. It's a bit of a follow-up. So I noticed a good size lineup in the rain at yesterday's mobile clinic outside the North Bay Mall. Have there been similar experiences with the bus lately? And are the majority of people first or second dose vaccinations?
Thanks for that question, Rich. Yes, it has been very successful. Most bus clinics have been, we've had really good uptake at. And there's been a good mix of first and second doses at the clinic. Sometimes it's half and half. Sometimes it's actually more first dose than second dose. So it's been really well received.
That's excellent. Our next question is for Dr. Churko, comes from PJ. Have there been any concerns expressed by businesses so far about the requirements for proof of vaccination?
Yeah, thank you for that question. We do have a call center. We've been inundated with many calls, mostly though from the public regarding the certificates and needing help to get their certificates, which we are facilitating. From the businesses, most of the concern is about the watermark and whether or not it's required. And as I've said before, it's not required. But we have had actually more from the public than from businesses. Businesses are being very compliant and certainly knowledgeable about what is required of them.
Thank you. Our next question is also for you, Dr. Churko. It comes from Jamie. Does the COVID-19 situation out west concern you? Are you worried about a rise in cases in our region or in this province as a whole?
I'm glad you raised that, Jamie, because it is a very, very important point. And I think what it really underscores is that you can see what happens when public health measures are ignored and the advice of public health. You can also see what happens if the vaccination rates are low. So does it concern me? Yeah, because it's an example of what potentially can happen. What I think the important message is that in Ontario, they've continued to keep the public health measures because they work and they're very helpful in reducing the spread. As well, getting vaccination rates up as high as we can possibly get them is really going to help prevent, and we know that it works, that it helps prevent serious illness, it helps prevent hospitalizations and people ending up in intensive care units and dying. We're also continuing to vaccinate those where we see that there may be some decrease in immunity in the older population, long-term care homes, high-risk retirement homes, elder care. So all those and those that are immunocompromised. So with all those efforts, yes, I'm concerned about a rise in cases. That's why we certainly are taking all those initiatives very seriously.
Thank you. So our next question is for Andrea. It comes from Jamie as well. So the vaccine passport rolled out yesterday, and Jamie has noticed that the mobile clinic at the North Bay Mall was very busy. Have people explained why they are there? Do you think that it has anything to do with the passport or certificate program?
Thanks for that question, Jamie. I think you are correct. I believe the vaccine passport has had an impact on the number of people that are coming to our buses. Some people do identify that they are there because of the vaccine passport and that they are getting their vaccine as a result of that. Others have just indicated that it hasn't been convenient for them up until now, or it was more convenient because the bus is in their neck of the woods, so to speak. So there's been a variety of reasons, and other people just they just come to get their vaccine and they don't necessarily provide a rationale on why they're there.
Thank you. This next question is also for you, Andrea. It comes from PJ. Have there been many third doses administered?
Yes, there have. That's a great question. We've administered over 500. I don't have the exact number, but I know we have administered over 500 doses. We've provided primary care with and specialty clinics and hospitals with the required form for them to fill out for patients to be able to bring to the clinics to receive their third dose. And so we've certainly had lots of people showing up to have their third doses.
Thank you. So that concludes all of the submitted questions. So that will end our press conference for today. Just a reminder that there will not be a press conference next week. So we will see you in 2 weeks. Thank you.
Thank you.